Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Inter-occlusal relationships can best be evaluated when the study models are mounted on an articulator. A suitable articulator for this procedure is one that will allow a centric mounting with some freedom to develop eccentric excursions. A plasterless articulator of the Galletti type is very useful for mounting study casts. Information which is achieved on the mounted study models and correlated with information from the oral examination will lead to the development of the diagnosis and the proper treatment plan. The level of the occlusal plane can be accurately observed, and recommended changes can be outlined on the study cast. The degree of occlusal reduction necessary to provide space for tooth replacement can be noted. Changes in the level of the posterior occlusal plane can be observed in relation to the anterior teeth and other commonly utilized landmarks. Variations in occlusal height bilaterally can be easily discerned. When all data has been recorded from the articulated study models, the diagnostic cast is then transferred to the dental surveyor for further detailed observations. Those teeth which may support the prosthetic appliance must be examined for contours that will permit proper clasping. Lingual surfaces should be checked for relative parallelism and to locate areas which might interfere with placement of the appliance. Soft tissue contours are examined for possible areas that will interfere with seating of the framework, particularly the major connectors and the bases. Following an accurate survey of the study model, a tentative appliance design is drawn on the cast as a guide for developing proper tooth contours during mouth preparation procedures. A detailed treatment plan must be based on information gathered from a completed mouth radiographic survey, accurate study models, the patient's medical and dental history, and the oral examination. A patient questionnaire may be used to reveal abnormal systemic conditions and determine the attitudes and complaints regarding his past dental history. General patient information which may be pertinent to the treatment plan is condensed and recorded in the patient's record. Affirmative answers to the patient questionnaire must be explored to the fullest detail for conditions which might affect or influence the ultimate plan of treatment. Radiographic findings are also recorded in the patient's record. These include the presence of caries, and periapical pathology. Radiographic information related to the alveolar structures is listed. This includes the complete healing of previous extraction sites and radiolucencies in the alveolar bone. Root length and root form of the prospective abutments are related to crown length and crown form. Open tooth contacts of prospective abutment teeth are recorded. In addition, the following must be noted: the pulp size and thickness of the periodontal membrane, the level of the alveolar bone in relation to the cemento-enamel junction, the degree of extrusion of remaining teeth, open contacts, and the pulp size in relation to the clinical crown as it may affect tooth reduction. The level of alveolar bone around the remaining teeth, as well as the alveolar level of the edentulous ridge area, is observed. The removal of excessive alveolar bone in critical areas must be part of the treatment plan. Following the examination procedures, all information pertinent to treatment planning may be condensed and recorded on a single information sheet. Vitality readings of the remaining teeth are designated. Periodontal condition, degree of extrusion, carious lesions, tooth mobility, and any other information that has been developed from our diagnostic procedures are carefully evaluated and used to design a detailed plan of mouth reconstruction. The primary treatment plan for this patient consists of prophylaxis and oral hygiene instruction, occlusal adjustment, and endodontic procedures on teeth numbers 12 and 14. Tooth number 12 requires endodontic treatment because of the carious exposure and resultant periapical pathology. The gross reduction of the crown in tooth number 14 to achieve interocclusal space necessitates devitalization procedures. Crown and bridge procedures are necessary on the remaining posterior teeth to permit an opening of 1 millimeter and establish an arbitrary posterior occlusal plane, as well as to achieve other desirable effects. Splitting of teeth 28 and 29 will stabilize their interproximal relationship. Interproximal stability will also be achieved by splitting teeth 20 and 21. This splitting will allow development of proper contours and control the additional stresses that will be placed on these teeth by the proposed removable partial denture. Fixed bridges are planned to replace the missing maxillary posterior teeth. These bridges extending from teeth number 2 to 5 and 13 to 15 will be constructed simultaneously to achieve the necessary bite opening and establish a more desirable plane of occlusion. Operative restorations are needed in teeth numbers 6, 10, and 11. Finally, a bilateral distal extension removable partial denture will be constructed to replace missing posterior teeth, support the occlusion, and restore lost function. The tentative design of the removable appliance includes lingual bar major connector combination clasp direct retainers, rigid lingual reciprocal arms, resilient 18-gauge wrought retentive arms, and indirect retainers in the form of additional occlusal rests on teeth 22 and 28.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.